Dr. Roger Kapoor is with us tonight. We're talking about NorthPointe Neighborhood Hospital. Thank you so much for being here.
Thank you for having me.
So let's start with what is a neighborhood hospital?
That's a great question. Neighborhood hospitals have really been born out of a changing healthcare landscape that's been evolving over the past few decades, really focusing on cost effectiveness, efficiency, affordability, and accessibility. And neighborhood hospitals, when affiliated with a larger hospital, play a real vital role for urban and rural communities with limited access to emergency services, stabilizing care, and low medical acuity care.
So why is that so important for our community?
Well, it's a lot of this is based out of the data that we've acquired from community health needs assessment surveys that are showing that accessibility to care is becoming a real priority for the state line community. And the proposal that we're putting forward is to seek permission to invest money to basically bring that access to you locally, to move hospital level care locally to this neighborhood, to establish a 24/7 emergency room, which we're very grateful to have all local EMS and first responders supporting this proposal and project, to open up the doors for access to care to people regardless of their ability to pay. And the data is also showing that individuals from the state line, from Illinois specifically, are seeking care in Wisconsin because they can't find it here in Illinois.
Wow.
And at the Beloit Hospital, we're starting to see a lot of Illinois residents come to Wisconsin, which is becoming an issue for our Wisconsin-based hospital, where we're actually starting to move all of our private beds, make them all private beds. We've got some double occupancy beds, and we've heard from survey results that we've got to move to private beds. So we're trying to do the right thing there, reduce our capacity at the hospital, but then wanting to have local care be local right here in the state of Illinois.
So you mentioned that the neighborhood hospital is in connection with a hospital that we know as a regular hospital, for lack of better words. So what's the difference then between the two of them?
Well, the neighborhood hospital is going to be a small footprint. It's going to have just 10 beds, all 10 private inpatient beds right at the NorthPointe Health and Wellness campus. It'll have an emergency room and an immediate care, and it'll basically allow for ambulances to remain local. So if you were to call 911 from the state line community right now, the closest Illinois hospital would be in Rockford, migrating all of your care, all of your family needs to transport down there. What we're trying to do is keep local EMS available, accessible to this community at a rapid pace, especially when seconds count. And again, that's why we're seeing so much outpouring of support from our EMS and first responders for this project.
So what is treated at the neighborhood hospital?
We define low acuity medical care as things like uncontrolled hypertension. Maybe you have pneumonia or difficulty breathing. Maybe you have a bleeding ulcer, you have some pain in your stomach. These are some of the things that, if left untreated, could turn into disastrous consequences. As we know, even in our elderly population, a small urinary tract infection, if left untreated, can lead to a lot of confusion, cause sepsis in the body, and ultimately, if untreated, actually result in someone's death.
So what do you want our viewers to know, what they can do to help this project along?
Well, I appreciate that. If you believe that primary care is an issue, that accessibility to care is an issue, we have an upcoming public open town hall meeting on August 13th at 1:30 p.m. in the Roscoe Township Community Center, where people can come to voice their support for this project, which we want to hear. We want to know that this is organically supported by this community. We also have a petition online that we ask for all of your viewers to consider going and signing in support of this project so we can move forward and invest the money to bring the services we know is needed for this beautiful community.
Great, and I'm sure on that website we can also learn a little more information if anyone has any questions, or reach out to anybody to get some more information too.
Absolutely.
Perfect. Well, thank you so much for sharing all of this with us tonight. Coming up next, we're learning all about Oregon STEM schools and then Global Games Week trivia with Q98.5.